Welcome to today's webcast from the Agency for Healthcare Research and Quality about how to use the AHRQ SOPS Ambulatory Surgery Center survey to improve patient safety. My name is Joanne Sora, and I'll be serving as your moderator for today's webcast. Next slide. Before we begin, I have just a few housekeeping details. If you're having difficulty hearing the audio from your computer speakers, you can change the audio selection so that WebEx can call you back and connect through your phone instead. If your computer freezes during the presentations, you can try logging out and logging back into the webcast to refresh the page. Remember, though, that you may just be experiencing a lag in the advancement of the slides due to your internet connection speed. If you need help at any time during this webcast, use the Q&A icon that will show you how to use in the next slide. Next slide. At any point throughout today's presentation, if you have any technical difficulties or have a question for our speakers, you may ask a question through the Q&A feature. Depending on the browser you're using, your WebEx screen may look slightly different than this slide, but look for the Q&A icon at the bottom right-hand side of your screen and be sure that the drop-down option displays all panelists for you to ask your question so our team can see it. Please feel free to share your organization name or role when you ask your question. Today's session is being recorded, and a replay of today's webcast and the slides will be made available on the AHRQ website. Next slide. Now that we have the housekeeping items out of the way, I'm happy to introduce our speakers for today's webcast. I'm very pleased to welcome Dr. Karen Ginsberg, who leads AHRQ's work on the surveys on patient safety culture, as well as the Consumer Assessment of Healthcare Providers and Systems, or CAPS. An anthropologist and demographer, she has broad-based experience in patient safety and in patient experience of care. At AHRQ, she focuses on program development, implementation, operations, and evaluation, with specialty in survey design and development and qualitative evaluation and assessment. I'm also pleased to introduce Lisa Sinsel, who currently serves as the Senior Director of Clinical Services at Surgical Care Affiliates, where she's responsible for evaluating, selecting, and deploying system-wide clinical applications, data and performance analysis, strategic planning, oversight of organization quality outcomes reporting, and benchmarking. And we also have Teresa Famularo, who is the SOPS Database Manager at Westat. She has more than 20 years of experience in health services research, including data collection, reporting, and dissemination. She has managed the SOPS databases since 2006 and also contributes to the development of the survey tools and supporting materials. And as mentioned earlier, my name is Joanne Sora. I'm the project director for the contract that supports the SOPS surveys, and I worked on the development of the ASC SOPS survey. I'll be serving as the moderator for today's webcast. Next slide. So here's our agenda for today's webcast. We'll start with Karen Ginsberg providing an overview of AHRQ's patient safety priorities and programs. Then we'll hear from Lisa Sinsel, who will share her experiences with using the survey to improve patient safety at her facilities. Teresa Famularo will discuss the ASC database and various resources available to users. And last, we look forward to answering some of your questions. With that, I'm going to hand this over to Karen Ginsberg to get us started. Next slide, and Karen, you're on.
Hi, everybody. Good afternoon or good morning if you're calling from the West Coast. Thank you for attending this webcast today on the Ambulatory Surgery Center surveys on patient safety culture. And I want to welcome the new users who are on today, as well as the more experienced users of the SOPS surveys. And I noticed that there were many people who are not affiliated with ambulatory surgery centers as well. So I'm glad you're all following along our work and keeping up with the work that we're doing. Before we get to the main program, I just want to mention that the work today is in preparation for data submission for the ASC SOP that's coming up later this year. So we want to make sure that you all are prepared to submit data if that's what you plan to do, to collect and submit it. We have a very active and engaged and a technical assistance program, and we'll tell you how to reach our technical assistance line, and we're happy to work with you and help you strategize, think things through, and answer your questions. So don't hesitate to call us to talk about things or ask us for whatever you need to know. I just also want to alert you to a couple products that we're going to be releasing this year. And so look for them. They are supplemental item sets that accompany the SOPS core surveys. One is on diagnostic safety to accompany the medical office survey. So look for that if you're interested in that survey. And we'll be releasing one on workplace safety coming up much later in the spring or summer. Right now, we're focusing that on as a supplemental item set to the hospital survey, but we want to see if it's applicable to other settings as well. So sign up for our email listserv, and we'll tell you how to do that as well. Next slide, please. So before we get started with the main program, I want to tell you a little bit about our agency and patient safety priorities at our agency in the SOPS program. So if you're not familiar with the Agency for Healthcare Research and Quality, we're an R&D kind of agency. We're a research and science-based arm of the U.S. Department of Health and Human Services. And what our mission is basically to improve the life of patients by helping healthcare systems and professionals deliver care that's of high quality and high value and care that's safe. So we do this by investing in research and evidence to make healthcare safer, improve quality. We create tools for you all to use to improve care for your patients. And we generate measures and data that can be used by providers or policymakers or researchers to not only improve performance of the healthcare system, but also to evaluate its progress. And we feel, and this is really important to our agency, that we push our science to implementation, get our tools out to you, our users. Next slide, please. So our patient safety priorities at AHRQ are to focus on the areas of greatest impact, extend improvements to all settings, prevent healthcare-associated infections and reduce antibiotic resistance, build capacity in the healthcare system to accelerate safety improvements, improve communications between clinicians and patients, and then just make it easy to do what's safe, to implement safe practices. Next slide, please. I'm going to tell you a little bit about our program, and looking at this slide, it just occurred to me, this is our 20th year, so happy birthday to us. We are now a mature AHRQ program, and I'll tell you a little bit more about what we do. We are best known for our surveys of patient safety culture. They are validated measurement instruments that use the best methods in their development and their testing. In addition to our surveys, we conduct research to further our understanding of patient safety culture, how to measure it, how to improve it. And, our work on patient safety, on quality improvement, is really focused on the use of SOPS data. Next slide, please. So let me just talk a little bit about the definition of patient safety culture. We define it as the cluster of beliefs and values and norms that are all shared by healthcare providers and staff in an organization. And these beliefs and values and norms support and promote patient safety within an organization. We say that patient safety culture determines the behaviors that are rewarded, supported, expected, and accepted within an organization as it relates to patient safety. So we want to note that the culture can exist at multiple levels in an organization, from the unit and department level within an organization to the system level as well. And then I think I have one more slide. I just briefly want to review our composite measures, or clusters of individual items into discrete domains, or composite measures. And by the way, this is all on our website, and you'll have copies of our slides available to you as well. So we have 8 composite measures: communication about patient information, communication openness, staffing, work pressure and pace, teamwork, staff training, organizational learning and continuous improvement, response to mistakes, and management support for patient safety. And then we also have some single item measures on near-miss documentation. We have an overall rating on patient safety, and we have 3 items on communication in the procedure or surgery room. So I'm going to turn this over to Lisa now. And again, thank you so much for attending this webcast. Lisa?
Thanks so much, Karen, and hello, everyone. It is an honor and privilege to be with you today and to share some of my experiences and also my organization's journey as it relates to the AHRQ SOPS survey. We'll go ahead and move on to the next slide. And first, let's just pause and talk a little bit about why, as an organization, we at SCA decided to assess the culture of patient safety in our ASCs. And it really boils down to what has been happening around us within our industry for the past several years. And we wanted to be confident that the culture within our organization was one that supported patient safety. The information on this slide depicts some of this journey, beginning with regulatory involvement, meaning the federal government, and their efforts related to value-based purchasing, what's happened with developing the ASC quality reporting program, and the expectation to measure and report patient safety related quality metrics. And depending on the measure, these can and do become made available to the public, and there is increasing pressure, as we all know, to be more transparent. And as an organization, we sought to continually strive for zero harm related patient outcomes, and we had heard of the AHRQ creating the ASC specific SOPS survey back in 2015, and we were interested, because we wanted to establish a baseline so we could benchmark and determine how we were really doing when compared to other ASCs. And then based on our findings, we felt that it would help us with our efforts towards high reliability and then ultimately resulting in the safest environment for our patients. Next slide, please. So we decided early in 2018 that we wanted to conduct a survey, and although we had conducted many, many surveys over the years before this, this one was a new one for us. This would be the first time to formally ask, our surgeons, our anesthesia providers, our nursing staff, and any other staff member providing care to our patients, essentially, how safe they felt their environment was for patients. So we started by reviewing, doing a lot of reading, research, looking at evidence-based literature, and the many resources that AHRQ had available on their website. You're going to hear more about them later in the call, but I did just want to mention and call out the SOPS Survey User Guide. It was a wonderful resource for us. It served as a roadmap. It really provided step-by-step instructions on exactly what we needed to do, and we followed it to the letter. And, once we felt confident about the survey and what would be involved, we further educated and partnered with our organization's leadership, who was extremely supportive and, from the very beginning has been a critical component to our success. Then we established a SOPS survey task force with representatives from our leadership team and then also many of the roles that would be included in the survey to ensure we were being very intentional, very thoughtful about each audience as we developed and managed and communicated the information about the survey, but also our overall program. Then we decided to use a third-party vendor who had expertise with the SOPS survey because we knew, this being new, we would need a thought partner as we prepared for the survey. We also felt very strongly about the validity of our results and felt that if they were managed by a third party, we could ensure the responses remained anonymous, that people could feel secure, about that, and that we could potentially get better feedback as a result. We chose to deploy the survey using the email mode because we felt this would be a better experience for our staff members, and the turnaround on our results was going to be, that much quicker. And we wanted the ability to formally benchmark by submitting our data to the AHRQ database, and knew that if the data was already, readily available, it would likely be that much easier and seamless of a process to submit it. And then once, all those decisions were made, we started to develop the timeline to successfully deploy the survey. Next slide, please. So this just gives you an idea of what that timeline looked like, and we applied this to the 2 years we had deployed the survey so far. So we launched our first survey back in May of 2018, and the second survey was deployed around the same time of the following year. During the pre-survey phase, we did all the things I just referenced on the earlier side, in addition to educating our teams about the survey. This was new, and we really wanted to make sure that they knew how important it was to us and how vital their feedback was going to be in supporting our efforts. We deployed the survey in May, and found this to be a good time frame because it didn't conflict, with any other holidays. It wasn't during a period where there are typically many people out, such as with spring break or in the middle of the summer. It also gave us time to meet the June 2019 deadline to submit our data to the database. And as I mentioned earlier, the survey was managed by our third-party vendor and was sent out by email over a 3-week period with an additional attempt in week 2 and then an additional attempt in week 3, for anyone that had not completed it. And from there, we analyzed our results to identify, where were we really strong at, where did we have opportunity to improve, and then compared our results in 2019 against our initial survey in 2018. In the 2018 survey, we compared our results with the AHRQ cohort study, and then later in 2019, we were able to, benchmark with the database because we were able to formally submit that year. Then we moved on to action planning with the intent of implementing new actions and remeasuring about 12 months later. And then in our experience, and because of the size of our organization, just as kind of a time frame, it took us somewhere between 4 to 6 months from deployment of the survey through, documentation of the action plan. Next slide, please. So just a little bit more about our results. We found our results to be, really consistent with the results provided by the AHRQ. First, as I mentioned from the cohort study, we compared our 2018 survey results to that, and then from what we submitted to the database in 2019. And although our results were quite good and very, very similar to the benchmarks that were provided through the AHRQ, we wanted to further validate our results and also performed on-site assessments to observe behaviors and conducted some staff interviews where we were able to validate some of our survey findings, and most notably involving the area of communication. We did receive a very comprehensive report from the data we submitted to the database that was extremely helpful and demonstrated how we did compared to other ASCs that also submitted data at the same time. And then initially or internally, we used our data to develop dashboards and are very early in the process, but we're starting to compare our survey data with our data in other areas such as patient satisfaction, tenure, of staff, patient outcomes, things like that, to determine, are we seeing a relationship? So we're really excited about the learning that may come from that. And then, as I mentioned, having the ability to see our results and how we compared really allowed us to deploy very intentional and very focused actions. Next slide, please. So in terms of lessons learned, we have had many successes and we've had some challenges, too. I've just listed a handful here, but essentially we saw improvement, both in participation year over year and in our overall results in year 2 compared to year 1. We gained a lot of experience, and with each survey experience, we continue to get a little better and better. Our teams now, I'll say it's ingrained in our culture, recognize the survey, but more importantly, they know why we do it, and that we use the data to, that we receive from it to continually raise that bar when it comes to patient safety. And our vendor, was a wonderful thought partner for us and really has been a big reason we have also been so successful with this program. We used them for the 2 surveys we had done so far, and we'll be using them again for our survey this year. We successfully submitted data to the database, and this is something we are extremely proud of. And the data from our survey has allowed us, to look in areas we may not have looked before, and as a result, we're really deepening our analysis. And as I mentioned when I first started speaking, we aspire to be a high reliable organization, and this is a wonderful way to support those efforts. And then on the right, you'll just see a list of some challenges. Most of these are pretty tactical, but very, manageable, and were pretty easy to resolve during the second survey. So the first being accurate contact information, primarily with our physicians. And so when we would ask for, email contact information from them, or depending on what we had, that was in our profile for each physician, oftentimes it would be their email that was used for their office. And so it was a global group-like email, and of course the email would go to the group and not directly to the physician. So we had to do better in that area in the second year. I mentioned something about determining ideal timing of the survey and whether or not it conflicted with any other holiday, or, typically times where volume is really high, like typically during the fourth quarter may not be the ideal time, because typically in an ASC we're so busy towards the end of the year, that may not be the ideal timing. And then the other thing we had to look at was, are there other surveys, that are going on within any other department that might be supporting your facility. So we typically do teammate satisfaction surveys and also physician satisfaction surveys, and so we had to be very thoughtful not to have survey fatigue or survey burden, and May was just the right time for us. Supporting participants with email address or access, I'll just say this is another lesson learned for us from year 1 to year 2 using email or, surveys, which was we allowed all of our participants to use personal emails in year 1, thinking that we would have a higher participation rate. And what happened was it really caused some challenges instead of us using our organizational emails, because our leaders could not go in to somebody's personal email account to help them necessarily look for an email. We had no control over whitelisting to accept the email from our vendor. And so in year 2, we just said we may have to go through that with some of the physicians, but when it comes to any of our staff where we are providing emails, we're going to use that email, and it went much better the next time around. I have to kind of chuckle about this next one. I can chuckle about it now, but we went hard on the first survey. We were, determined that we were going to have a phenomenal, survey experience, and we were going to get great results. And if we had any opportunities to do better, we were going to deploy all these recommendations, through AHRQ and other organizations in all of these composites. And as you can imagine, that didn't go over really well, but we were really hungry and we wanted it to. And so we were trying to solve for all things in year 1, and we quickly learned when it comes to culture and behavior, and then just a positive experience. That really wasn't the best strategy. And so going in our survey in the second year, we really focused on actions on the vital few and putting emphasis on where the biggest opportunity was, and to really just focus on that. Let's get really good on that, and remeasure, and we'll just continue to raise the bar versus trying to solve all things at one time. The other thing that came up was about action planning. And so, again, this was a brand new process for us, and I know AHRQ has got a great tool for action planning. We just deployed the tool, the first time around, and the second time around, and we got variability, I'll say, in terms of understanding and if they filled it out complete, and some of it was hard for us to analyze some of the data because we did not do a good job talking or teaching some of our leaders about action planning. And so second year around, completely different experience. Before we got into action planning, we were very thoughtful and intentional about expectations and consistency in how we were utilizing the tool. And then availability of ASC-specific tools. I know also AHRQ's got some great tools when it comes to strategies and how you can raise performance in many of the composites. And we, as an industry, I'll just say, have a huge opportunity to develop, vet, pilot, study, develop ASC-specific tools as well. And I think that'll take us to the next slide. So in terms of next steps for us, we're extremely excited. We are going to be administering our third annual survey May of this year. We skipped last year because of everything that was happening with COVID. It just, didn't make sense. It wasn't the right time, and we had facilities that were shutting down. But we do plan to deploy the survey this year using the same approach with, by email with a third-party vendor and submitting to the AHRQ database. We're extremely excited to see what our results look like this year, and we want to celebrate that success. And then in terms of just opportunities, kind of a plug or a shout out to, anyone listening that is a leader or represents the ASC community specifically. This is a wonderful opportunity for us to determine, establish baseline measurement for us to benchmark, and then based on what we find to develop, new evidence-based practices specifically for the ASC community. I think if we'll go to the next slide, we've got some contact information. My name is Lisa Sensel, and my email, I can be reached at lisa.sensel@scasurgery.com. And I think with that, I will pass the presentation over to Teresa.
Thank you so much, Lisa. That was fantastic. So again, my name is Teresa Familaro, and I will be speaking about the SOPS ASC databases and resources. So AHRQ supports 5 SOPS databases for each of the 5 core SOPS surveys: hospital, nursing home, medical office, community pharmacy, and ambulatory surgery center. Today we'll be speaking about the SOPS Ambulatory Surgery Center, or ASC database. The SOPS ASC database is a central repository for survey data from the SOPS ASC survey. Healthcare organizations that administer the SOPS ASC survey can voluntarily submit their data to the database. The SOPS ASC database allows ASCs to compare their facility survey results to other participating ASCs, and all data that is reported is de-identified. So the 2020 SOPS ASC database was released in January of 2020, and this database contains 282 participating ASCs with 10,527 respondents. And 37% of ASCs in the 2020 database were from ASCs that had 4 to 5 surgical rooms, and 77 of participating ASCs were multi-specialty. In regards to respondents in the database, 35% of those respondents were nurses, and 44% of all respondents worked 32 to 40 hours in their ASC per week. So the 2020 SOPS ASC database report presents average % positive composite measures and item results. So as you can see here, the highest reported composite measure is organizational learning continuous improvement at 92% positive. And this composite measure assesses the extent to which facilities actively look for ways to improve patient safety and make changes to ensure that problems do not reoccur. And then we also show the rest of the composite measures, and the lowest scoring composite measure is staffing, work pressure, and pace at 74% positive. And this composite measure assesses respondent perceptions about whether there are enough staff to handle the workload, whether they do not feel rushed, and whether they have enough time to properly prepare for procedures. And so if we want to drill down a little bit into the item level results, we can drill down into the highest scoring composite measure items. And so here I'm showing you the 3 highest scoring composite measure items that came from communication about patient information and communication openness composite measures. And so you see the item important patient safety information is clearly communicated across areas in this facility, scored the highest at 95% positive from participating ASCs. And the 2 lowest scoring items were from the staff training and the staff training and the staff work pressure and pace composite measures. And here you see at 53% positive, respondents answered that they did not feel rushed when taking care of patients. So going further into the 2020 database, SOPS ASC database, we see on average 88% of respondents reported always or most of the time that when something happens that could harm the patient but does not, it is documented in an incident or occurrence report. And on average, 86% of respondents gave their ASC an overall rating on patient safety or of excellent or very good. There were also 3 items to assess elements related to communication in the surgery procedure room. And only physicians and staff who were typically in the room during surgeries, procedures, or treatments answered the items, which were measured on a frequency scale ranging from never to always. So here you see on average, 93% of respondents reported that at the start of procedures, team members stopped most of the time or always to discuss the overall plan of what was to be done. So I think Elise gave some really nice reasons of why you should participate in the SOPS ASC database, but I'm going to add a few that you might want to consider. First of all, facilities that submit to the database are part of the results produced in a database report with de-identified facility level statistics. And here's an example of the 2020 SOPS ASC Executive Summary infographic that you can download as well on the AHRQ website. And there's another benefit to your organization for participating in the database. Each participating ASC will receive a feedback report comparing their results to the database. So here you can see some sample results in your feedback report at the composite measure level. So when can you submit to the next SOPS ASC database? Well, database submission will be open from June 1st to June 21st of this year in 2021. And who is eligible to submit to the SOPS ASC database? Well, eligible ASCs are CMS certified and approved ASCs with a valid CMS certification number or CCN number. ASCs are eligible for those that provide surgical procedural services to patients that do not require hospitalization except in unusual circumstances, and ASCs that do not share space with a hospital or hospital outpatient surgery department. So here I'm going to explain to you the steps in the SOPS ASC data submission process. Basically, there are 4 easy steps. Step 1 is register for the SOPS ASC database. An announcement to register will come out through the SOPS ASC listserv on June 1st, and you can register anytime during the submission period of June 1st to June 21st. Step 2, sign and submit a data use agreement or DUA. The DUA assures ASCs of the confidentiality of their data and explains how their data will be used. You can actually submit your DUA even before the data submission period, as we know how hard it is for things to go through your legal department. Enter your ASC site information and submit your questionnaire review. And here we actually recommend that ASCs send their questionnaires to the SOPS ASC database for review prior to data collection or survey administration. So if you haven't submitted or administered the survey yet, please feel free to send the survey that you plan to administer to our help desk, and we will review it ahead of time. And then step 4, submit your survey data. Once you submit your data, you will get an automatic frequency report that will indicate if your survey data was submitted correctly. Lisa mentioned this during her presentation. This is the survey user's guide. So if you have not administered the SOPS ASC survey yet, we strongly recommend that you review this guide. The survey's user's guide provides detailed information and guidance about how to administer the SOPS ASC survey, and the guide can be found on the AHRQ website. I'll just highlight a few key points that are in the guide in the next few slides. So first of all, we're going to talk about data collection. You can administer the survey by paper or web. You can hire a vendor to do your survey administration or opt to administer the survey in-house. 72% of the SOPS, the 2020 SOPS ASC database facilities used web to administer their survey. You can also hire a vendor to do your survey administration, or you can do it in-house. There are pros and cons to using a vendor. Pros include such as experienced staff, neutrality and credibility of survey results, better quality and more timely results, and using an outside vendor can assist in ensuring confidentiality. The cons of a vendor are basically the expense or cost of hiring the vendor. If you are planning on administering the survey in-house, please make sure that you have the staff and capabilities to collect the data, analyze it, and report back the results in a timely manner. And regardless of whether you use a vendor or not, if you are surveying multiple sites within your system, each ASC needs an identifying number so responses can be linked to a specific site. The SOPS ASC survey is designed to be administered to all staff as appropriate, such as physicians, nurse anesthetists, technicians, management, administrative staff, clerical, and business staff. Staff members could be non-clinical, clinical, part-time, full-time, per diem employees, and contract employees. I think I got everybody there. Staff should have worked at the ASC at least 4 times in the past month and been working at the ASC for at least 6 months. And surveyed staff should have enough knowledge of the ASC and its operations to provide informed answer to the survey questions. For staff at more than one ASC, the survey should be distributed at the ASC where they spend most of their time, and staff should answer only about that specific ASC. If they spend equal time at multiple ASCs, choose one center and have them answer the survey only for that specific center. The guide also has a survey administration timeline, but here is an abbreviated version of the timeline for project planning and survey administration of the SOPS ASC survey. You can find a more detailed version in the survey user's guide. The data collection period is expected to be around 3 to 4 weeks, and pre-planning will take several weeks because of getting your leadership on board and promotion. Promotion is especially important before and after, or before and during data collection, just to ensure your maximum responses. And here are all the SOPS ASC resources. We have the SOPS ASC survey. It's both in English and in Spanish, the user's guide, and then the SOPS ASC data entry and analysis tool, which you can use to enter your survey data and analyze it. You can download most of these on the AHRQ SOPS website, and you can request the data entry and analysis tool by contacting our help desk mentioned later in the webcast. So SOPS also has improvement resources that you can use to help increase your scores. After you've administered the survey and analyzed your SOPS results, we have an action planning tool that assists you in developing an action plan based on your SOPS results for patient safety culture improvement in your organization. And as you're working on your action plans and identifying areas for improvement, you might be interested in checking out our SOPS ASC resource list. This document contains links to practical resources that are free and publicly available to improve patient safety culture and patient safety in your ASC. SOPS also has a bibliography on the AHRQ website. The bibliography provides citations for published articles using the AHRQ SOPS surveys. It includes references on the use of the surveys, patient safety culture improvement, psychometric analysis linking the surveys to outcome data, systematic reviews of patient safety culture surveys, and international research. You can also search for articles by setting. So here, as I mentioned earlier, we do offer technical assistance for the SOPS surveys and the databases. It is free. Our database TA help desk can be reached at 1-888-324-9790 or databases on safetyculture@westat.com. And they can send you the SOPS data entry and analysis tool and provide assistance on using that. Help with submitting to the various database, answer questions about the database report, and respond to special analytic requests from data included in the SOPS ASC database or any SOPS database. You can also visit the AHRQ website at www.ahrq.gov/SOPS for more information. And to be reminded about the data submission dates and how to submit to the SOPS ASC database, we recommend that you sign up for SOPS email updates. Through this listserv, we periodically send email announcements about SOPS news, such as new webcasts, data submission timelines, and other products. You can sign up for email updates from us by going to the AHRQ website and clicking in the right-hand corner and choosing the email updates associated with the surveys on patient safety culture. There is one listserv specific for the SOPS ASC survey. So I think that's about all I have, and I'll send this over to Joanne.
Thanks so much, Teresa. And also thank you, Karen and Lisa, for your really informative presentations. A lot of information was shared today. So we're going to go now to the Q&A portion of the webcast. And so as a reminder, you can type a question in the Q&A box by looking for the Q&A icon at the bottom right-hand side of your screen, and be sure that the drop-down option displays all panelists so our team can see it. Again, feel free to share your organization or role when you type your question. And depending on the browser you're using, your WebEx screen may look slightly different than this slide. And so while you're submitting your questions, we'll start with some questions that we received during registration. And I'll read these aloud so that our speakers can provide answers. So the first question is for Teresa. Can hospital-based outpatient surgery centers submit data to the SOPS ASC database?
So thanks. That is a very nuanced question that I think I can answer here. As I said in my presentation, ASCs that do not share space with a hospital or hospital outpatient surgery department are eligible. If the ASC is in a hospital and it's sharing space with the hospital, then they would not be ineligible. So if your ASC is part of a larger health system or hospital system, but is in a separate location, and what I mean by a separate location is not sharing the same, I would say, facility space or in the same building, but somewhere else, and you have a CCN number or CMS certification number, and the patients that you see do not require hospitalization except in unusual circumstances, then yes, you can submit to the database.
Okay, great. Teresa, it looks like we have another question here from Tom Simpleman. Is there a cost to facilities for participating in the database?
You know, there is no cost. It is absolutely free to submit to the database, and our database technical assistants can also help you if you have questions about how to submit or if you need help in submitting. That is also free as well.
Okay, great. Next question. Are the various SOPS surveys used internationally, and does that affect the ability to benchmark? This is for Teresa.
So the SOPS surveys are definitely used internationally. If you go onto the AHRQ website, we do have an entire page under international users that describes the countries and the surveys that are being used, as well as, I would say, unofficial translations. However, because for comparative purposes and because we review each survey that goes into the database, all of the database users are from U.S. or U.S. territories, so we do not accept international versions or international submissions. I hope I answered that correctly.
Yeah. Thank you. And this next question looks like it's for Lisa, and it's from Washington Advocate for Patient YU. And it says, thanks for your presentation and efforts. Do you see any improvement in patient outcomes based on the survey results? And secondly, are there any outcome measures that are relevant to the SOPS survey?
Yeah, that's a great question. Both questions are great. We're still pretty early. You know, honestly, this is going to be our third time. So it's too early for us to tell yet if we're seeing a reduction in, you know, patient falls, for example, as a result of our culture survey results. But it is something we're looking at, and you know, like I said, we're hopeful with year 3 and, you know, maybe even year 5 that we'll be able to show some evidence of a reduction there. And then in terms of, I think the second question was whether or not there was alignment with some of our outcomes and each of the composites. So we haven't taken a stab at aligning, you know, do patient falls, for example, align with communication composite or something along those lines. But I think it is a good call out. I think it is something that is worth looking at. And I think that's why I say we've got a great opportunity, right, for us to do more work in that space, but still pretty early to tell. And so we'll see what happens.
Great, thank you. It's very hard, as we all know, correlating measures and moving the needle. So we'll look forward to you maybe keeping us posted, Lisa, on your journey as you administer the survey this year, and when you eventually are able to link to outcomes, we'd be happy to hear more about that.
Absolutely.
The next question looks like it's for Teresa from Leslie Castaneda. Where can I find more information on the diagnostic safety items that were mentioned at the beginning of the presentation?
So the diagnostic safety items, we are planning on releasing that later this year. I think we are not sharing anything at present because we're still in the process of doing the final psychometric analysis where we validate and ensure that the survey is measuring, the survey is reliable and valid, and that it's truly measuring the patient safety cultures areas that we've assigned to it. But I would just look out for that later this year. We did do a pilot test in 66 medical offices, and you will be seeing that pilot results report also too will be posted this year. So just, you know, sneak preview. And I also would suggest as a user that you sign up for the medical office SOPS listserv, because when they are posted, we will send an announcement out.
Okay, great. Thank you. I think this next question is for you, Teresa, also from Sandy Thompson. It sounds like they didn't get to submit their 2020 data or their last ASC SOPS data by the last database benchmark submission date. And so I guess they're wondering, can they submit their 2020 data for this upcoming data submission in 2021?
Absolutely. We typically, we typically have our data submission period. I think for the 2020 database, the SOPS ASC database, that was in June and July of 2019. And so we close out the submission period for the 2020 database in July of 2019. So yes, if your data was in August, as early as August 2019, feel free to submit to the next database this year. Yep, absolutely.
So the eligible time frame then, Teresa, is almost 2 years or something like that.
Absolutely, yes. And that's really what we recommend users to do the survey every 2 years so that they have enough time for patient safety improvement.
Okay. Let's see. Another question. This question will be for Lisa. Lisa, can you say a little bit more about how the COVID-19 pandemic may have affected your patient safety culture scores, or how you might anticipate that they're affecting ASCs and patient safety?
Sure. Honestly, I would say that we didn't survey this year, obviously, because our volume was down. We had, facilities that were closing, and just with everything that was going on, we weren't sure, what results would look like. It just wasn't the ideal time. This time going in, I think we're optimistic. And I think, obviously we all have feelings associated to COVID, and it's been a terrible, impact on our country and definitely affects, culture. But our experience has been a culture of leaning in, of no lines in leadership, of really collaborating and having teamwork and working together and doing whatever it took to, to make things work, for the betterment of our patients and that kind of thing. So we're optimistic. Could there be an impact? Absolutely. We'll have to, see what that looks like when we get our results, but we are optimistic just in the way our community has come together to collaborate and work together during a very difficult time. So more to come.
Yeah, it's definitely been a very difficult time. Hopefully it'll be a little bit more stable when you administer the survey in May. And Lisa, just another question for you. How often would you recommend that ASCs administer the survey? Every year, every 2 years?
When we, as I mentioned kind of earlier in my presentation, that we were so optimistic and so hungry and so seeking to understand that we decided we were going to do this assessment every year. And we did, and we learned just in the 2 years that it takes and feels like it takes much longer just to impact behavior, even for, the facility, a facility leader to implement change and make it sticky, if you will. We lean more now towards what Teresa just mentioned, which is AHRQ is taking data on a every 2 year basis. They've learned, and have evidence as well. And we're leaning in that direction. I'm not sure what will happen after we do this next survey, especially with COVID, but we are leaning towards that direction just based on our experience for the first 2 years. It could be every 2 years.
Every 2 years, yeah. Okay, great. Thank you. And Teresa, it looks like we have a question for you from Heidi Thompson, who's saying she's new to the use of the surveys, and she's wondering, which survey should she choose? And she doesn't exactly say what setting she's from. And so I guess she's just wondering, which survey do you use for which setting?
Sure. Okay, so I think if we're talking about the SOPS Ambulatory Surgery Center or SOPS ASC survey, that is for mostly freestanding ambulatory surgery centers with a Medicare CCN number, and they, as I had mentioned before, that they don't share space with a hospital, and that they see patients that do not require hospitalization. However, we've had some, I know that there are some medical offices that have perhaps their medical office, their practice, but also to have an ambulatory surgery center associated with it or on site with the medical office or connected to the medical office. And so I think in that case, it would just depend. It would depend on what you're trying to measure and what you're trying to improve. If you want to look at more specific things related to your ASC, part of your medical office, then I would administer that one. Or if you want to look at more medical office activities and perceptions, then you would administer that one. If you are doing any sort of inpatient, that means where patients stay overnight, and that could be at any type of hospital, regular general acute care. It could be cancer hospital, children's, pediatric, rehab, any sort of, or long-term hospital. You can definitely administer the hospital.
Oh, okay. And I think she just clarified that she is from a freestanding ASC.
Okay. Yes. Then I would definitely, in her case, use the SOPS ASC survey. Absolutely.
Oh, yeah, that's the one we've been talking about.
That's the one we're talking about today. Yep.
All right. And it looks like we have time for maybe one more question to follow up from Jonas Schultz about the international users. So if this person is an international user and they can't submit to the database, what do you recommend that they do?
So you can at least, it's not a true comparison, but you can look at your results, your specific site's results in your country compared to the database, although it's not a true comparison because you're looking at specifically U.S. and U.S. territory facilities. We also have heard, and you may consider contacting our help desk, where we do have some countries that have formed sort of, I would say, coalitions or user groups. And for example, we know that some of the Arab countries have formed some sort of coalition, and they may be interested in sharing their results with one another, so that you can compare your results from similar country or the same country or similar regions around the world. So we do, if you contact us, we can provide you with some contacts of users of the surveys for your country or your language.
Great. Well, thank you so much. I just want to thank Karen and Lisa and Teresa for all the information today. If you have any questions, feel free to contact our technical assistants email or phone lines. And so just to let everyone know that a brief webcast evaluation will pop up when you close out from today's webcast, and we encourage you to please take a moment to provide us with your feedback because it helps us improve our offerings and plan future events that will meet your needs. And you can please visit the AHRQ website or contact us at any time. Thanks again for joining us. This concludes today's presentation.